Guests on Keel heard via the Jack Spring Electric Keel Newsmaker hotline. Dr. Chris Kevil is Vice Chancellor for Research at Louisiana State University Health Science Center here in Shreveport. Hey, Dr. Chris, welcome to Keel. How you doing this morning?
Doing great. How are you all?
We had Dr. Ghali on last week, and he said his world basically has come to a stop, that nothing really else matters anymore, that it is all-consuming. I'm talking about, well, you know, the coronavirus. Is that basically what your life has come to also at this point?
Yes, sir, it has. This virus and the emergency that it has brought to our doorstep has brought all hands on deck so we can deal with this exclusively.
So you're Vice Chancellor for Research. What are you researching that has to do with this?
Right. So as Dr. Ghali probably spoke about during his interview, we recently stood up the Emerging Viral Threat Laboratory on our campus with the goal of being able to help out in testing. As many people in the community and nationwide have heard, testing is absolutely essential in being able to understand who has been infected by the virus so that we can either appropriately give them the care that they need, or more importantly, get them to go home and quarantine themselves. And so our campus is really helping contribute to that through the beginning of this Emerging Viral Threat Lab that will really be helping amplify testing capability in our region.
How many people is that otherwise would be doing something else? Because you read all the time, and you read it's like every day, that this is causing an overload in the healthcare industry, so to speak. And I would imagine to some degree what is meant by that is it's taking people that normally, like you, like your staff, that would be working on other things, and it's making you become basically a MASH unit, right?
Absolutely. And in fact, that's one of the things that had been really instrumental and pivotal in the early stages of this outbreak up at University of Washington with colleagues up there that were bringing not only their researchers, but their graduate students to the fight, where the graduate students would actually contribute to running the test. So much so that was a story on NPR this past week. In fact, I think it was still up yesterday. Demonstrating how many individuals that are in an academic medical center are contributing to handling this virus in ways that they never thought that they'd do before.
You know, that's an interesting point, because I heard an interview this morning he's an anesthesiologist, and he's not a young man. He's been an anesthesiologist for 20 or 25 years, and he says suddenly, that was where I got the analogy, he says suddenly I'm Hawkeye on MASH. I would imagine that a lot of folks at your place are doing the same thing right now, huh?
Absolutely. And in fact, I tell you, one of the things that's been very heartening and has been just good to see, even in the face of such a tragedy, is that everyone that's associated with the medical and biomedical scientific community is willing to step up and participate in the fight. So as we've heard a lot, that we Americans have an incredible amount of resiliency and determination. It's being manifest on a day-to-day basis right here in the community, with people stepping up to help with the cause.
Doc, people don't realize that this lab could be a game changer in terms of getting results back quickly, et cetera. Is it actually up and going now?
Yes, ma'am, it is. And in fact, we've been working with our partner hospital, the Austrian LSU health system, to help them do the testing of the individuals that are coming into the emergency room, as well as individuals that are on the floor. And that's really critical, because when we work together, we're able to make decisions that are in the best interest of not only the people coming to the hospital, but people that are in the hospital, so that we can appropriately put them on a different floor away from the other individuals that don't have COVID-19, so that we can mitigate or stop the spread. So the lab is definitely up and running, and it will be continuing to increase its workflow and its output. And on top of that, one of the things we definitely are in the process of doing is reaching out to other entities, institutions, et cetera, that really need some help. And we'll be doing that over the next 2 weeks. One of the things I will say is that in our region, we haven't had this kind of laboratory before. We're very lucky that not only that we have an academic medical center in our midst, but two, that we have outstanding international and nationally funded virologists. And without those virologists, we wouldn't have been able to put together this laboratory. And it's that knowledge base that we're leveraging every day to help try to keep our citizens safe and make sure that we can mitigate the impact of this virus.
Let me ask you a dumb question, if you don't mind. Let's say, excuse me, let's say someone goes to get tested, but we've heard all the horror stories about it's taking 7 and 10, 12 days to get those results back. Can I ask my doctor, hey, I want my test handled by your lab? Can we request that? Is that part of this process or no?
Well, so right now, that is already being handled internally. We've already worked out the internal workings so that, for example, if someone comes to LSU and gets a nasal swab, that specimen will go to the clinical laboratory. And at that point, given the volume of specimens that are to be tested, we identify who's got the lowest number, can get to the test the fastest. And that's when that sample is sent in that direction. So we're really triaging the samples just as much as we're triaging, say, for example, the patients coming in.
I think Dr. Ghali had mentioned that. I'm sorry, go ahead, finish your thought.
No. Please go ahead.
Dr. Ghali, I think he had said you guys are handling as many, or at some point will be able to handle as many as 5,000 tests a day. Did I see that right? Is my memory correct in that regard?
I don't think it'll be that much. We're ramping up to get to the range of 1,000 to a peak of 2,000 tests a day.
Right.
That's going to take a little bit of time to get there. Right now, what we're in the process of doing is making sure that we've worked out a very seamless system where we're engaging with the clinical laboratory and the hospital and with other entities in the community so that we can provide the turnaround time of the test for 48 hours is our goal. Certainly going to work toward getting it down to 24 hours. But we just started this lab up the middle or end of last week, so to speak. So it's taken us a little time to get there, but we're already meeting that 48-hour turnaround time, which is fantastic because it's allowing people to make decisions that are critical for these individuals.
If I were to ask how you increase the turnaround time by 100%, I guess 50%, from 48 to 24 hours, is that something that you could explain to me, or is that over my head?
No. I think it's really an issue of logistics. To be honest, I think those of us here locally and nationally, there have been many constraints on the concept of testing, the least of which has been from the number of kits that are available. We designed this lab so that we're not dependent upon commercially prefabricated kits. So in other words, we can be flexible and adjust on the fly. So that saves us time. And then the logistics of actually getting the specimen to our laboratory, because that takes time from taking it from the patient, getting it logged into the system, and then to us. So we're working all of those out, and that's what I think we're going to see a significant amount of expedited speed there, if you will, over the next several days. But one of the things that's exciting is that there are new assays coming on the market now that can turn around test results very, very quickly. And we're looking at obtaining and procuring some of those pieces of equipment in conjunction with our clinical partner so that we'll all be able to be even faster than what we're at now.
Okay, I'm sorry. We were going to let you go, but I do have one more sort of dumb question, to use Erin's lexicon. These tests come in. Is it like FedEx or UPS? How is that done?
Yeah, so early in the game, it was by FedEx, UPS, because the reality is this is a very specialized, complex genetic test that not all laboratories had. And so in the early phase of the game, these tests were being sent up to places like Mayo or to other commercial laboratories. And unfortunately, at the time, they were overrun with a deluge of samples. So it's laboratories like our EVT lab that was stood up that really helps create a escape valve, if you will, for these tests, so they can come to us and we can read them very quickly because we have the capability to do this complex testing. So I think hopefully over the next week to 2 weeks, even as we get into the crucial phase of this virus, the key is to keep the testing going so that we can make sure we understand where we are with the virus.
Wait a minute. You just said crucial phase of this virus. What does that mean?
I'm sure many people have gone online and looked at different sites and things of that nature to look at the viral outbreak pattern. And right now, depending upon which websites you look at, the surge, if you will, of people that would be infected with the virus is predicted to occur within the next 2 weeks. And so we want to make sure that in this period that we're geared to be able to test those individuals that come in either to the emergency room or the hospital, so we can identify if those patients are truly infected with the COVID virus. There's several web sources out there that could show very nicely what the peak of the viral infection looks like. In fact, Dr. Tony Fauci, who's been with President Trump's viral response team, has talked about this a lot. So really the next 2 to 3 weeks are going to be a period where it's really critical that we're able to test very reliably.